We will invite Charles Book to give us speak about the dose that is a secret that can't be taught. Please welcome Charles. I'm sorry, could you please let me introduce Charles Book briefly. Charles Book is a practitioner, educator, and author in Chinese medicine. He is currently the chairman of the British Acupuncture Council. He is a fellow of the British Acupuncture Council and of the Register of Chinese Herbal Medicine in practice for 30 years. Charles is a well-known and respected figure who pioneered the teaching and practice of Zhongyao in the UK. His most recent publication is Acupuncture and Chinese Medicine, Roots of the Modern Practice. Please welcome Charles Book.
Thank you. I want to first just thank the organisers for inviting me to this today. What you're going to get from me is very short and sweet, and is really about my experience of practicing Chinese herbal medicine in the UK for the last 31 years. When I started, there were no wholesale importers. There were no wholesale importers at all in the UK bringing Chinese herbs in. So I think I was in the first 5 practitioners practicing Chinese herbal medicine in the UK. And I had to go to Chinatown in Manchester, to the Hong Kong Chinese community as it was then, to persuade a Chinese herb pharmacy to sell me Chinese herbs. So this is a summary of my experience, particularly in relation to the question of dosage in the treatment of disease with Chinese medicine. So that's what this is about. When we learn as students, we're learning our book learning, and we're learning in our universities or our colleges, and we learn how to write prescriptions, and we learn the doses that we're expected to use. And so this is what I followed in my early years. And of course then there's the clinical experience. Actually, when you start to do this on real people, and you begin to learn what really happens with people. And so this is a very short summary of my own personal experiences of the importance of dosage and getting that exactly right. So sometimes we find that the prescription that we give is correct, but the dosage can be completely wrong. Sometimes the dosage can be too high, sometimes the dosage can be too low. I'm not the first person to question the dosage. A famous Qing dynasty doctor, Xu Dachun, made comments about dosage as well. So he was saying that in his opinion, many of the doctors of his era were giving doses that were far too high. I agree with that. Sometimes we give doses that are too high. I also feel that sometimes we give doses that are too low. So when we look at a modern Chinese textbook, and we look at the formula Xiao Yao San, for example, these are the typical doses that we're expected to prescribe. This is the sort of thing that we would give for a one-day Fanji prescription bag, using 10 grams of chai hu, 15 grams of bai shao, and all those usual herbs. But if we go back and look at the original source text in the Jin Yuan dynasty, we find that the doses of each of these herbs were something like this. Well, not something like this, exactly this. 1 gram of chai hu, 1 gram of bai shao, 1 gram of dan gui. So this is really quite different. Who's right? The answer is that neither is right, really. The answer is that it depends on the exact patient in front of you at any particular time. So I've actually had experience of the dose problem numerous times over the last 30 years. Hundreds and hundreds of times have I got the dose completely wrong. Sometimes too high, sometimes too low. But certain cases stick in your mind. And so one case with a deficiency syndrome that I remember seeing that sticks in my mind from many years ago was a lady called Mary who had Parkinson's disease, and she was in her early 70s, and she came to me, and she'd clearly got a condition of blood deficiency in Chinese medicine, blood and yin deficiency of the liver with internal stirring of liver wind. So I wrote a prescription for her that looked like this. This was a bag intended for 2 days, so I was giving her basically the So Wu Tang and then adding other things for internal wind. So each of these bags was intended to last her 2 days. She phoned me up after a couple of days and said, "Mr. Buck, these herbs are terrible. I can't follow these things." And so I didn't want to argue with her. I said, "I tell you what I want you to do is to boil up those herbs and put them into ice cube containers in your freezer, and then just take 1 or 2 ice cubes a day. 2 ice cubes a day," I said. So I was just thinking, no point in wasting those herbs. I'd intended those herbs to last her for 10 days. 6 months later, I said, "Phone me," at the time I said, "Phone me back if you're running out or you want to speak to me." So she phoned me back 6 months later, and she said, "Please, Mr. Park, can I have some more of those herbs?" So I said, "Well, are they working? Have they made any difference?" And she said, "Yes," she said, "my nails are growing stronger, and my skin feels better, and my hair is growing better." And she wasn't trained in Chinese medicine. She didn't know what I was doing. She thought I was treating her Parkinson's disease, whereas really I was treating the underlying condition as much as that. So she had taken a prescription that was intended for 10 days over 6 months, and it has still worked. So I learned something from that. So also I've seen lots of phlegm damp patterns. In Britain we get people with sinus problems and chronic obstructive conditions of the sinuses involving phlegm damp. So when I was in China watching and looking at prescriptions for this that I saw in the Shuguang hospital, for example, in Shanghai, they would look something like this for 1 day, for a 1-day bag. There would be Fa Banxia 9 grams, Hopo 9 grams, Changju 9 grams, Chenpi 6 grams. This was how a typical formula would look there. So this is what I gave to patients. I gave patients, and then I had one lady come back to me after a week, and I said, "Is it working? Is it beginning to dry out the sinuses?" "Yes," she said, "I've got tight pain across my sinuses, and I woke up last night with my tongue stuck to the roof of my mouth." And so I was simply following the rules, what the books say, what they did in China, and I found it didn't suit my patients at all. And I got sick of that not really working. I was really cross that I was doing what I was supposed to do and it wasn't working. So I decided again to try a different method. I got 3 new patients in 1 week, all coming with sinus problems. So I thought, I'm going to say something different. So I decided to try a different method. And so here's one of the 3 cases. This was a man who had chronic obstructive nasal congestion since the age of 9 or 10, and he's now 52. So this was a man who was completely blocked. He couldn't breathe at all through his nasal passages. He'd got constant headaches across the front. He'd got no sense of smell or taste whatsoever. He could smell or taste nothing. He'd got a dry mouth and throat. He got encrusted, he said it was crumbly and dry stuff that was in his nasal passages. Some phlegm on his chest that was difficult to cough up. So he also got fullness in his ears and tinnitus. So I decided that he had got congested heat in the lung channel, that he'd got injury to the lung fluids, he'd got a loss of the swan function, the dispersing function of the lung qi, he'd got dry phlegm, and also that there was not enough ascent of the clear qi, that the spleen clear qi wasn't ascending sufficiently. So I said to him, nothing is going to change. You're going to take these herbs for months. And for the first 3 months, almost nothing is going to change. I want you to take it 3 months, 6 months, 9 months. And again, I used the ice cube method. And here's the prescription I wrote. And so each one of these bags was enough. I was giving him for 10 days. A lot of Chinese hospitals will give that for 1 day. So this was a bag for 10 days. The prescription isn't especially interesting, it's just the normal kind of prescription we would do for something like this. It's quite complicated. So after 2 weeks, his headache had gone. After 6 weeks, he could smell things. He was getting flashes of smell coming back. After 4 months, he was completely clear. So he'd had this problem for 40 years or over 40 years, and so it wasn't going to change in a week. It wasn't going to change in 2 weeks. I had to adjust the dose to a tiny dose, much smaller than most practitioners would tend to use. And this is another quote from Chun, where he says, "When doctors toss medicines into patients and fail to get results, they doubt their actions and try another prescription, even though the first one was right. They're simply not given enough time for the prescription to work. They try mistaken herbs, and the more they change things, the more serious things become." So sometimes the dose is a really crucial thing that has got to match the patient. Sometimes the dose is also too excessive. I'll just give you one example of a patient, actually where the dose was insufficient. And this was a lady I treated for chronic fatigue syndrome for some time, and we've generally done her a lot of good. And then she came to me with a rather nasty, unresolved chest infection. She was coughing up little streaks, even with a little bit of blood in her chest. And I think she'd had antibiotics from a doctor that hadn't worked. So I was using a prescription that was basically Qin Qi Hua Tan Wan, or Tan Tan, using 9 grams of Huang Qin, and I was using 8 grams of Huang Qi in there as well. And I gave this prescription at a good solid Chinese dose for a week, and she came back after a week and said, "No difference, it's made no difference whatsoever." I was disappointed, but I thought the prescription is right, I'm going to continue for another week. So she came back a week later and she brought 4 bags back because she said the thing cleared in 2 days on the second prescription. I was suspicious. So the bags she brought back I opened up, and I found that my pharmacy in my clinic had put 18 grams of Huang Qin in and 9 grams of Huang Qi. They swapped them around. So I used a double dose of Huang Qin, and that worked in 2 days. So that's another question. That's the opposite. That's a question where where I personally was using a dose that was too low of Huang Qin. And that's the interesting thing. That's really a very interesting thing about practicing Chinese medicine, the way that we learn from clinical experience, as long as we don't blind ourselves to that. So what I've learned is that dose has to be appropriate, and that in a sense we can't teach in a college course. It's very difficult to teach what appropriate is. So sometimes 10% of the dose, the textbook dose is correct, and sometimes 200% of the dose is correct, at least in my view. So we need to have an understanding of what people's capacity is to change. We need to be able to have a sense of how things can really change, and we can't teach that. So that's why the dose is the secret that we can't teach.
Thank you, Chancellor. Because the time is very tight, so only one question available. So sorry about that. Anybody question?